Hello everybody, my name is Dr. Parsa Karimi from PKL Physical Therapy with offices in Amityville and Bethpage, Long Island, New York. In addition to providing physical therapy, we also provide what's called PT-directed fitness programs in both of our offices. The reason we do that is everybody who's trying to learn how to work out, sometimes they go into a gym and it's pretty scary. It's intimidating. There's all these exercises going on. You don't know who's doing what correctly. You're trying to watch to see maybe this guy's doing this one exercise. You don't know if he's doing it correctly or not. So you're basically learning by watching people that you don't even know whether they're doing it correctly or not. You can go get a trainer, and I don't know what they charge nowadays, but the best way to do it, in my opinion, is to go to a facility that physical therapists are watching you doing the exercises. We are the experts when it comes to any kind of weight training, and we should be. And you can look around at my office here, you can see there's weights everywhere, there's more weights over here, more weights over here. This could be kind of scary too for people walking in. But what we do is we determine exactly what your strength level is, and then we design a program based on what you're deficient in. So if one muscle group is very weak, then we try to build that muscle group back up so we can achieve muscle balance. In doing so, we start to advance your program to allow you to do more and more weight, which is comfortable for you, which as long as you have no pain and this perfect range of motion, we start to gradually increase your weight. And what I mean is by maybe a pound or two with each exercise, or a couple of pounds with some of the bigger exercises. Whatever you can do to gradually get stronger, that's what we teach you. And in doing all that for the whole body, every muscle group, we break it up. You come maybe a couple of times a week. You're learning how to exercise. You're learning what you should feel during an exercise. Meaning, if you're doing a bicep curl, you should feel muscle tension in the muscle. You shouldn't feel joint pain here or up here in the shoulder. That's not normal. Or if you're doing any knee extension exercises, you shouldn't feel pressure at the knee. That's not normal. You should feel it in the quadricep muscle. All those things with all these different exercises, while we're watching you do the exercise routine, we can ask you, where do you feel that? Well, I feel it here. Okay, that's okay. Keep going. How does that weight feel? Does it feel like it's good? Do you feel like you can do an extra few repetitions after the 10 that we're asking you to do? Yes, if so, then maybe we should bump the weight up. All those things are helping you understand the guidelines of exercise, when you should increase weight, what you should feel and what you shouldn't feel during the exercises. So basically what you're getting is an education on how to weight train. And anybody who's over the age of 50, 60 years old needs to be in a gym 4 or 5 days a week doing weight training exercises. I'm very happy for you if you walk, but you've been walking since you're 1. You don't get a cookie for walking. That's good. I'm not saying stop walking, but you need to be in a gym and actually build up muscle tissue, because at a certain age, in your 50s, you start to lose muscle mass every year. And you lose muscle mass, you're starting to lose strength. You lose strength, you lose function. Like it says back there, strength equals function. If you don't have strength, don't expect to have some kind of functional activity, capabilities. You're going to start seeing that it's harder for you to walk, and you're going to need some help like a walker or a cane, and there's no reason for it. So strengthening, 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 that's the most important part of getting older. Everybody in their 20s and 30s, 40s, 50s, everybody should be in the gym doing some level of weight training. But don't be scared by the whole idea of going into a gym. That's why you learn, you educate yourself before you go in. If you wanted to go learn how to dance, what would you do? You wouldn't just go out on the dance floor and bust a move in front of everybody on a Saturday night. No, you learn how to dance first, take some lessons, and then you go. If you want to learn how to fight, you go take some MMA classes. You wouldn't just go into a ring and say, all right, let's get it on. So you want to learn what you need to be doing in a gym so you don't hurt yourself and you get the most out of your workouts. PT-directed fitness programs. Look it up on our website. PKLPT.com is our website. Give us a call if you have any questions. Get started today to make you a healthier you.